Hi, today I'm going to be explaining on how we can transfer patients onto the toilet bowl and off the toilet bowl. Toilet transfers are usually used for patients who experience difficulties or who may struggle at transferring themselves from their wheelchair and onto the toilet bowl. Usually this happens for patients who are unable to use both their legs and so they can't maintain good balance. First, what we want to do is we want to position the wheelchair at a right angle. When I say a right angle, it should be facing the toilet wall, which has the wall rail. This way, when the patient gets up, they can immediately grab onto the wall rail to secure their balance. After positioning the wheelchair, don't forget to lock the wheels and to remove or raise the footrests which are in front of the wheelchair. Place a transfer belt around the patient's waist, and by using an underhand grasp, you're going to use one hand so that it's facing the patient's back and the other hand so that it's facing the patient's front. After placing the transfer belt, what you want to do is you're going to ask the patient to put their stronger leg slightly behind their weaker leg and to bring themselves up into a standing position by pushing themselves, so that once they're in the standing position, they can immediately grab on to the wall. After the patient gets into a standing position and is holding onto the wall rails, both of their hands, you're going to get them to pivot slightly to the back or step around so that they can feel the toilet seat on the back of their legs. And once that has happened, you're going to help them by assisting them in sliding down their underwear or sliding down their pants, and then you're going to assist them into a sitting position. Once the patient is finished with their business, you're going to put on disposable gloves and get some toilet tissue, as you're going to ask the patient to stand up and grab onto the wall rail. And while they are grabbing onto the wall rail, you're going to help them by cleaning them if they are unable to do so. Cleaning the patient, dispose your gloves and dispose the tissue used. Pull up the patient's pants and underwear. Then if the sink is close enough, you can have the patient pivot or step around until they reach the sink so that they can wash their hands. But if not, then help them to get back on the wheelchair so that you can move them closer to the sink so that they can wash their hands. And after the patient has washed their hands, wash your hands too, and then the both of you can leave the toilet.